All right, ACL reconstruction, knee pain related to ACL tear. So what is your ACL? So ACL stands for anterior cruciate ligament, and it's a ligament on the inside portion of your knee which prevents, it's called anterior translation, or the forward slippage of your tibia, so the lower leg bone, under the femur towards the front. Here is your knee joint. So this is a right knee. I'm just going to pull the kneecap to the side here, and then I'm going to bend this back, and I'm going to show you this. ACL is right in here. Right in here. Okay? So that's a ligament. That's called your ACL. And if that tears, there can be multiple different tears of that, different grades. So a grade 1 is a mild stretching of the fibers. Mild stretching of the fibers. Grade 2 is where you can imagine half of it is completely torn, and grade 3 is it's completely torn. Mild grade 1, maybe even partial grade 2 tears can be conservatively rehabbed. A lot of quad strength, a lot of hip strength, a lot of good neuromuscular control training for the legs, core stability and strength to get all that stuff working in conjunction. Good hamstring strength as well. A lot of that can be rehabbed. We test if you have we test if you still have good integrity of your ACL through a Lockman's test. Feel free to look it up. It's just where they pretty much pull on your tibia like this, and they stabilize your fibula, and then they pull like that. So they try to create that anterior translation. If that one doesn't feel like your opposite one, there's a good chance that it's torn. You need to be referred to an orthopedist or a sports medicine guy who can order an MRI of your knee to see what grade of tear it is. Grade 3 tears will need to be surgically reconstructed if you plan on playing sports again. It's very common in cutting injuries, in cutting sports like soccer, basketball, volleyball. Handball right now is the #1 sport that has all those injuries. Not so common in the United States, but in Europe it's extremely common. Feel free to look up videos of handball ACL tears. You'll see just people's knees collapsing inward and blowing up the ligaments. But you should expect after an ACL reconstruction, it's going to take about a year or so for you to get back. Between 6 months and a year. I'd say average is probably about 9 months. The earliest that I've seen somebody get back to their return to sport, so return to progression to playing in their sport, has been 6 months. And this person was an absolute freak. They didn't lose strength of their muscles at all. It was amazing to see. Division I basketball athlete, so amazing. But the timeline might be a little different if you have other injuries also, like injuries to the MCL or the medial collateral ligament, the LCL, the PCL, so the posterior cruciate ligament on the back side of the knee. Timelines can vary as well. You can also get bone bruises with your ACL. It's often common to get a meniscal tear with your ACL. So when you go through a rehab program, there should be some kind of protocol like this that they have to go through, or that you will have to go through. You have to meet certain criteria in order to progress to the next stage, and so on. And that's how that works. It's a little bit of time dependent, but you want to check these boxes. So one of the most common things that I see that people screw up too soon is they start running too soon. Usually about 12 weeks is when you can start to run. But if you're not strong enough, if you don't have like 85% quad strength on your affected leg compared with your opposite leg, you're going to cause other problems, other tendonitis issues at your leg. So that's just a little bit of an overview about ACLs. And yeah.